Depression strikes at least 10% of the world's population. Men, women, the elderly, middle-aged, young adults, even children can suffer from depression. If you or someone you know or love is suffering from depression, what can be done? Today on Ministry in Motion, we're going to explore ministering to those with depression with psychiatrist Dr. Torben Bergland, who is the Associate Director of Adventist Health Ministries at the General Conference. You're watching Ministry in Motion, where we explore best practices for your ministry in the 21st century. Torben, what is depression?
Well, I think when we're talking about depression, it's important to recognize that depression is not one thing. There are many kinds of depression, and it can be experienced very different from person to person. So that's why also I think people need to be respectful. If I have experienced depression, my way of dealing with it and coping with it may not be the same way that will help you and what you will benefit from. So it's a big sack, a big sack of different kind of conditions that have like similar symptoms.
Well, can you unpack some of those
Yes.
things in the sack?
Yes, one is the emotional part of it that we often think about. Depression is sort of in the word itself is something that is sort of pushed down. So, and that applies like to both the positive and actually the negative emotions also. Many people, they describe or think of depression as like an excess of negative emotions. And for some it is like that. But actually some people, they experience it more that it's just more an absence of feelings altogether, or a lot. So it's like the emotional life is so like almost down to zero, freezing point. Wow. And that sort of, you can just imagine how life is if there are no emotions, neither something that in a way maybe doesn't make you sad, nor that makes you happy.
So just an absence of emotions?
For some it's, but for some have more that it's a lot of more the negative emotions, excess of that. Also, so sadness, frustration, grief, hopelessness, all these kinds of emotions are typical.
Right, okay. Now, people can think that if you're a Christian, you know, and you have the fruit of one of the fruits of the Spirit is joy, how can a Christian ever be depressed? Help us to clarify that. Is that a reasonable presumption?
No, I don't think that's reasonable.
Okay.
I understand that sort of when you read the Bible, people can come up with that kind of ideas. For me, my question is, why aren't we all depressed? Like in the world we're living in, just think about it. If we were to really take in all the bad things that are happening around us, I think we all would be overwhelmed. The reason why we still can smile is because we have mechanisms, we're able to detach from all the bad things that are happening. But sometimes it just comes too close. And that's typically when people become depressed, when they're not able to, you don't have any more resilience, you don't have more ability to withstand the bad things that you are experiencing. And that threshold for when it becomes too much, it can be very difficult or different for various people. Some people are very resilient, others because of circumstances, life experiences, things that have happened, biology, then they may have a low threshold for like going into depression and other kinds of mental illness.
Right. Now, so it's more than sadness though, isn't it?
Yes, it's a lot of emotions that can have various kinds of emotions. It can be irritability, anger. Sometimes men can experience more of that, maybe than typically than women do. It can be hopelessness. Like various kinds of negative emotions that people can experience.
And it sounds like these are symptoms as well, Torben. So when
Yes.
you've got hopelessness, what are some of the other symptoms that a person with depression can face?
Well, typically there are two main characteristics. You have to have one of the two in order for it to be diagnosed as a depression.
Okay.
So then we're talking about the clinical diagnosis where people need treatment for it. So one is like the emotional part of it, where you're sad, where you're anxious, or have this empty feeling when it comes to emotion. So that's one.
Right.
The other thing is if you lose interest or pleasure in things that used to give you, like things you used to like. That could be hobbies, that can be work, that can be relationships, all kinds of things that used to be meaningful to you. When sort of that doesn't mean anything to you anymore. That's the other kind of like the main two. So one of the two you have to have in order for it to be a clinical depression.
Can you have both at the same time?
Definitely, you can definitely have both.
Wow.
So and often we see both of them also. But it's important to be aware that you can be depressed without being sad.
Right.
And that may be sort of not what people typically think, but that's possible. And what we sometimes see, like general practitioners, they know very well people come with all kinds of physical complaints sometimes. And when they dig deeper, they realize that underlying this is actually a depression.
Okay.
So it can have many sort of kinds of expressions.
So who's at risk? Who can suffer from depression?
Well, I think basically anyone can suffer from depression. If the things that you experience or life circumstances become like beyond what you're able to cope with, then depression or some other kind of mental illness may be the result of it. So that's important to there's no way to be immune towards it. This is part of living in this world, being human in this world, and depression is common. At any time, we estimate like almost 1 in 10. Like basically around the world, suffer a clinical depression. That means that they are in need of treatment. And then sort of you have the milder forms also. So it's a common experience like that. One time or another in life, at least most of us may experience some symptoms of it. Some will have the full-blown depression where you need or ought to have treatment if that's available.
So is there higher rates of depression amongst men or amongst women? Does it have a mature onset, or can it even impact children? And developing countries or so-called developed countries, what's the incidence? How does it manifest in that way?
Yeah, well, we typically the statistics indicate that it's about twice as common among women as it is among men.
Right.
Still, there's been some discussions also on that maybe sort of the way we perceive the concept of depression, maybe it's more sort of based on the female expression of depression, but generally still that's the general understanding that it is more common among women than men, but still it's common among men too.
Yes.
But maybe men, they will tend to deal with it in other ways, so it had different kinds of expression. Sometimes you will see that more men, maybe more acting out, can be more drug, alcohol abuse, that kind of things. Other ways of managing it, not just crying, maybe a woman would be more likely and culturally appropriate for a woman to do.
Yeah.
So, but age-wise also, it can like at any age,
Really?
it can hit, and we see kids, and it's rising among younger people and children.
So, how young can a person be diagnosed with depression?
Well, I think typically, we are a bit more careful in diagnosing and medicating when it is children.
Mm-hmm.
But it's still children are human beings,
Of course.
also.
Yeah.
And I think oftentimes we do not recognize how existential and deep children think. We think something that, well, that's just something adults do, but children think about death. Children are very sensitive and conscious about relationships, dynamics, family issues, that kind of things. So what you can see the same in a child, if a child withdraws, starts acting out, loses interest in things that they've used to be engaged in, that kind of things, that can be sort of warning signs and reasons to ask, sort of, what's going on here now?
And how long does it take somebody to descend into depression? Can it be almost an immediate thing, a quick thing, or does it take a significant period of time?
Well, the diagnostic criteria is that these symptoms have been sort of rather consistent, stable for a minimum of 2 weeks. So depression is not something that you have one day and next day you're fine, and then the next day again you are depressed. It's more stable than that, so it takes some time. So definitely like a few days typically of these symptoms in order for it to be considered as a depression. But then also usually it takes time to get out of it. Also, so it's like there's seldom any instant cure for depression.
Right, okay. So, well, in some senses, it's nice to know that if you're feeling blue one day, that, hey, it's not depression. You know, like it's a natural thing for people to have their ups and downs going through life, but this is more sustained, what you're saying.
It's more sustained, more prolonged, and I think that's very important to recognize that, like, our negative emotions, in a way, I don't like that term, because they are there for a reason. They are communicating something to us, that there are some issues that we need to deal with. I think there's a challenge in our cultures, and we have very low tolerance for negative emotions, and in various ways, like run away from them or medicate them away or use drugs to sort of get them away. But they are, like, in a way, our mental pain sensors. And we know, like, for the physical body, like, without pain sensors in the body, you would very quickly get hurt and injured and suffer because of that. I think, to me, that's the same with our emotions, that they are our pain and pleasure sensors, that we also should pay attention to. We should always listen to them. We shouldn't always do what they say. And especially when you sink into a depression, that affects how you think, how you process things, and it gives you, like, a negative bias. So be careful in a depression with what you do about the thoughts and the feelings that you have. That's one of the reasons we recommend to people that they don't make any major life decisions when they are struggling with a depression, unless it's absolutely necessary to get out of the depression. But for example, if people are very depressed, like their perspective on their relationship, their perspective on their work, perspective on themselves may be, like, excessively negative.
Right, okay. So let's come on to when you realize that you or somebody close to you is suffering with depression. What steps should a person take?
Well, I think the first is that the person and the ones surrounding them, they can help the person quite a bit, also, like, before necessarily you seek professional treatment.
So it's not a life sentence?
No, definitely not. No, that's our common perspective on depression, that it's treatable. Like, basically, I would say, like, basically all cases of depression are treatable. They are not always cured. Some people end up struggling with depressions on and off for the rest of their lives, or maybe some low-grade depression. But with appropriate intervention and treatment and help and social support, like, most people will have at least significantly better quality of life. So that is very important.
Yeah, okay. So what are the steps in the treatment? What should somebody do if they're suffering with this?
Well, I think the first thing is, like, this, to consider, like, the self-help things that you can do, like, in say, the more biological part. What is my lifestyle? Am I sleeping enough? Am I exercising? Am I eating properly? Is my environment like conducive to good mental health? That's one thing, like the physical part. Then definitely like the psychological part of it, which is always, in most cases, is important part of a depression, to understand sort of what's happened, what's going on in my life now, or am I struggling with issues that belong or the roots are in the past? Is this something I need to deal with?
What are some of those things that can linger from a person's past that can really trouble them and drag them into depression?
Well, like as psychiatrists and psychologists, we're often criticized for like we go back to the childhood, and that sort of we blame everything on the childhood or the parents. Well, there are good reasons why we tend to go back to the early years, because they are often so formative. What happened, like our concept of ourselves, concept of other people, concept of the world is like essentially shaped when you are young, and as we come into adulthood, it's difficult. It can be difficult. It takes effort to change these perspectives that we take with us from childhood. So that's why we tend to say that well, it is oftentimes, if it's a like if you're struggling with depression over time or some other mental health issue, if you have done various kinds of initiatives but you're not really getting help or getting well from it, then it's really maybe time to take a look at sort of your own history, what's hiding there.
Okay, and how does that help somebody come out of depression by looking at history? What should you do with it?
Well, I think often I'm like getting an understanding of who I am, why am I feeling the way I do. That can help you to deal with it differently. And sometimes when people are struggling, they're thinking, well, I'm not worth anything, I'm a bad person, no one likes me, that kind of things. If you can sort of trace some of the origins of that kind of thoughts, they may not sort of they don't go magically away, but you can give context to them, and then you can like consciously think differently or work differently with whatever is there, and eventually then it can be sort of sometimes a slow process for this to change, but still things can change.
Right. Okay. So what about the value of a therapist? Is a therapist helpful in this?
I think in most cases, when it becomes sort of a more long-term thing, when you have struggling over weeks, months with these things, most people, if they have access to a therapist, they ought to seek a therapist. That can be a psychologist, it can be a psychiatrist, it can be a counselor, it can be a doctor, someone who has knowledge and understanding of mental health issues. The challenge sometimes is like that, and what we know from therapy is that one of the most important factors for the effectiveness of a treatment is the relationship between the therapist and the patient. And as with all kinds of relationships, sometimes people match well, other times not. So that's where it can be a challenge sometimes. Like if you start a therapy, if the relationship doesn't work well, then maybe you need to look for someone else. So that's one of that's part of the job sometimes people have to do, that it sometimes takes time, and it's important that people don't give up until they have found sort of the therapist that actually where it works well.
Right. Okay. Now, depression is, I presume, a part of mental health, and oftentimes people have the idea that if we pray, God can cure our mental health. But I wonder whether it's a case of, in the same way, if a person has a physical ailment, we pray for them, but at times they need a physician to augment the healing process. Is it the same? Should a pastor feel comfortable about going to see a therapist, or should prayer, is it enough or isn't it enough?
Well, I think as in all aspects of life, a healthy spirituality is beneficial to mental health as it is to physical health. We know this from research, but it's not the same thing, one and the same thing. And I think that's where many people get confused when it comes to mental health, because we sort of equate physical health and mental health. We think that if you have good spiritual health, then you won't have any mental health issues. But that's not how I read the Bible. I see many people in the Bible who are struggling. And again, as I said in the beginning, I think like in this world that is ridden by sin in so many ways, like just as we struggle physically, we must acknowledge and expect that we in the same way can struggle mentally. Our mind is just another bodily function.
Yeah.
Like the rest of our body, we acknowledge that people can have physical issues, you can have, and sometimes chronic, and even sometimes you die from them. And the same, like in the extreme sense, applies to our mental health also. That sometimes you can get treatment, sometimes it will sort of just, the body will sort it out, your mind will sort it out yourself, you'll get over it. Sometimes it may become chronic, and also I think sometimes we have to acknowledge that mental illness can kill people. They don't, not that they directly die from the mental illness, but like suicide, which is the outcome we fear from mental illness, and is sort of the deadly outcome of a mental illness. That can also happen, and that just, in most cases, people just suffering so much that they cannot bear the thought of living anymore. So it's serious. Mental illness is serious. Potentially it can be deadly.
Yeah, and not to be ignored.
Definitely not.
Yeah.
No. It must be given attention and dealt with compassion, with empathy, and understanding. Because if people are not treated well, it may just make it worse.
And what's your thoughts on medication?
I think medication has a role in many cases, especially the more severe mental illnesses like schizophrenia, like bipolar disorder, but also when it comes to depression, anxiety, when you have done the other interventions, or if it's a severe case, then definitely medication has a role. And the thing is with medication, like, it doesn't change you for life. Like, it's worth trying. The thing is that it's harmful to go depressed long term. We know it's harmful to the brain. It can change the brain physically, not to mention all the negative outcomes for the life of the person, how it affects the life. So definitely, I think when people are struggling with depression, they should seek the treatment that is available, and as soon as possible. Also because the sooner you can start with treatment, the easier it may be to recover.
Okay. So how does it affect the brain long term if it's not treated?
Well, we can see that it actually can cause parts of the brain to shrink or increase. Also, so it really affects like the certain centers of the brain.
It really is a health issue, isn't it?
Well, definitely, and it's a whole body issue. It's not just about the brain, because it affects your physiology in the whole body. So we have to acknowledge it is an illness like anything else.
Yeah. So if you have a friend or a person in your church or congregation that you sense is suffering from depression, how should you approach somebody in that condition?
Well, I think it's very important that people are not left alone. Part of the dynamics of depression is often that people feel alone. I feel like nobody understands me.
Okay.
So that people reach out, take an interest, give them time, give them space, and listen. I think that's so valuable. And that's as a therapist, when I work with patients, often that's my main contribution. It's just having a space, having a room where people can talk,
Okay.
and where I listen attentively with interest, where I affirm them, where I seek to restore their dignity, their value, and try to counter some of those like dysfunctional thoughts that people may have. But it's important, like you should never attack someone.
Okay.
Like with what you say, criticize, that you may not disagree with everything that a person says, but still listen, be compassionate, try to be understanding, try to understand what the world looks like from the perspective of that person. Then you can also share that sometimes that, well, to me it looks like different, but I understand that this is how it feels to you. So, but to allow people space to tell their story, that's so important.
Yeah. And I imagine when somebody is suffering with depression, they're lethargic, they're not so motivated, they're probably not the best company to be around at that time. And the natural thing would be to withdraw from them.
Yes.
But this is where we really need to step in and be proactive, as you say. What else shouldn't we do?
Well, I think that's what you say, that they may not seem to be the best company. What's often the case, and why I sort of appreciate so much working with patients often, is that they are very honest. There's like when people are depressed, like the facade, sometimes it's gone. There's no point in keeping it up anymore. And then I've had that experience many times, like when you just get close to someone, when you take an interest, who you thought may not be good company, it turns out actually it can be very valuable.
Wow.
Also for me, as someone who's there to help and to support, to be part of it and engage in it. So, but it can be frustrating. It can be frustrating. Like the person is very frustrated themselves typically, and of course that can sort of be contagious in a way. But don't act out. Don't sort of reinforce the negative perceptions and the hopelessness that the person may have.
But you're describing there a rewarding experience when people are honest and you can help somebody.
Yes.
And they come out of it.
Yes.
Yeah.
And it's an opportunity to really get close to someone. So as a pastor, as a family member, if you just have sort of the willingness and the patience to invest in that situation, it can be a very good opportunity for a close contact with a fellow human being. And for me, like sometimes people have asked me, well, isn't it very draining? But for me, it has many ways been the opposite, because it's a very real encounter with another person that can be very stimulating and food for thought also in terms of how do I live my life. Because what we are dealing with is often it's common life issues that we all to some extent share in. So I sometimes said that for me it's been very good therapy for me to be a therapist.
Okay.
Because you're dealing with existential issues in many cases that are worth dealing with.
Torben, I just want to thank you. As a psychiatrist, sharing your expertise and helping us to understand a little more of this disease that people suffer from. And thank you for your ministry and thank you for sharing.
Thank you.
Thanks so much for joining us today for Ministry in Motion, where Dr. Torben Bergland looked at ministering to those with depression. These are the important take-home points from today's program. First of all, depression is treatable. Secondly, core symptoms are major mood changes, negative emotions or lack of feelings, and loss of interest in the things of life. The third major point was, when these symptoms persist for 2 weeks or more, it may be a case of depression. The fourth point was, avoid making major life decisions when you're experiencing depression unless it's necessary. And number 5, When there is a major depression, professional help should be sought as soon as possible. 6, medication may be beneficial and necessary in moderate and severe cases. And the 7th point, healthy spirituality is important, but it doesn't necessarily guarantee mental health. And the final point, reach out, listen to people with depression, and show empathy and compassion. Once again, thanks so much for joining us on Ministry in Motion. Until next time, may God bless you richly.